leadership changes at the top. We have a new director standing here, and we've made a number of other personnel changes. So that was something that we've already taken place. Again, we're going to continue to look at issues to see if more are required. But we've been very prompt in responding based on what their comments and concerns were.
For our friend behind Danielle, tell me, I'm sorry. No, you.
Okay, Governor, one thing that, besides the hardships people in Flint are experiencing with the water, one thing I think people outside of Flint don't really understand is that why people in Flint are paying such one of the highest water bills in the nation. And I'm told they're getting penalties if they decide to they want to cut off their water. So they're paying for water that's poisoning them. What can be done, and is that being addressed at all?
Well, again, there's lots of issues with respect to the whole transition of what took place, and that's what we're going through all these issues to say. That's why I created the advisory group in particular, an independent group of people to say what are the concerns and challenges to making the change. I know the mayor's concerned about it, and I continue to plan to work with the mayor to get feedback and input on how we can collaborate to make water more successful in Flint, but life in general better in Flint.
Gentlemen, John Paul.
Snyder, we talk about the short-term fixes, but what about the long-term in terms of helping to fix our infrastructure? Because we know that that's a big problem. Any idea on the time frame about that?
That's something we need to continue to work on. Again, that's a statewide issue. If you look at, we spent the last 3 years working on road infrastructure, and at the same time I made it clear that we need to work on our water and sewer infrastructure across the state of Michigan. So that's going to be an ongoing topic that we need to look at, particularly Flint, because of the immediate crisis, but longer term we need to look at how do we deal with aging infrastructure across Michigan for water and sewer.
On the floor is Steve Carmody, Michigan Radio.
Governor, you've got your State of the State coming up. How much of that is going to be affected by the Flint water crisis, and is this going to prevent you from doing any of the other things you want to do during the remainder of your term? Well,
again, this is something that deserves a lot of attention. This is a crisis, so we're responding appropriately. There's more work to be done. And I'm willing to roll up my sleeves and partner with the mayor and the city of Flint to do what needs to be done to solve this problem. So it's a key focus. At the same time, I will give a State of the State address and talk about some other initiatives. And again, I hope we have a broad enough team where we can work a parallel path on a number of other important topics to the future of Michigan. Much of this ties together. It's much like the question on water and sewer infrastructure. This is a real illustration that this is a real problem.
Right next to Chad, I'm sorry.
Elisha Anderson, Detroit Free Press. Do you think it's fair for the residents of Flint to have to pay for their water from April 2014 up until present, given they can't drink their water?
Again, I'm not going to speculate on all those kind of questions. There's a whole process for the water department. Again, I'm going to partner with the mayor on seeing what, if anything, should be addressed in terms of the particular situation on billing and such.
Mr. Kirsten.
Governor Jim Kirsten with Channel 7 out of Detroit. I asked you this last week. You said a short time ago you want to take all of the questions. It's been asked a few different ways, but what was your epiphany or your aha moment that this is a crisis and I need to act? Was that before just last week when you declared the emergency? And folding into that, you said your team responded in early October. No offense, but I asked Mr. Lyon over at Kettering University on October 2nd specifically if he thought this was an emergency as was declared locally. He responded no. So what did you know, and when did you know it, and when did it rise to the level of an emergency?
Well, I answered that earlier today. I said basically it's around October 1st with the confirmation of the blood test results. And so at that point, we moved actively to make a transition back to the Great Lakes Water Authority. We took multiple other steps that have included other 12,000 filters being distributed. Again, testing in schools, doing blood tests, raising the level of that, but it's not been enough. And so it needed to go to another level, and that's what we're doing now.
Dave Bonke's got one more.
If you had contaminated water coming from your tap at home, should you have to pay for it?
Again, that's one of the questions that we'll be reviewing.
No, the question is, should you be paying for contaminated water if it came out of your tap?
We're addressing the immediate issue now, which is making sure people have water filters.
You're not answering my question, sir.
I'm answering your question.
You're answering someone's question, but not mine.
Governor, just to follow up on Jim's question, if you thought it was an emergency and needed to switch water sources on October 1st, why'd you wait 3 months for an emergency declaration?
Well, again, we were taking actions to distribute water filter, free water, all those steps were taking place back in that day. In terms of the declaration process, that really follows a protocol. It says it goes from the city declaring it to the county to the state. But those actions were not taken until the new mayor took office, and I give her credit. That's why I want to really thank her for her efforts to highlight the nature of this issue and that more needed to be done.
There was an emergency
Jessica,
declaration
Jessica.
earlier in the fall.
Get back to you. Jessica?
Mayor Weaver,